Hello, inquirers, and welcome to the second diatribe on the podcast for inquiry feed. This is my personal opinion that follows and not necessarily representative for the Centre for Inquiry Canada, but I think this is definitely going to be of interest to our listeners. This is unscripted, and I am just wanting to vent about something that came to my attention recently. So, as I'm sure all of you know, we have Catholic hospitals in Canada, and I was largely under the impression that they were essentially just hospitals and were Catholic in nature primarily because of historical antecedents, and the institutions have prevailed to this day. However, that's not entirely true or accurate. What I have learned is that there is an organization called the Catholic Health Alliance of Canada, which operates in 8 Canadian provinces, and all told, there are 88,000 plus people working in Catholic healthcare centers in Canada. Now, these are regulated, and all employees, doctors, nurses, possibly even right down to janitorial staff, need to sign an ethics guide, which I think is fine. I think it's good that people working in healthcare need to sign an ethics guide. And the Catholic Health Alliance of Canada has what they call the Health Ethics Guide, and this is mandatory for all employees to sign. Now, I have spoken with a couple of folks that work within Catholic healthcare institutions, and these are like the ethics guides in most other organizations. It's an annual compliance task, and it is essentially a checkbox. And like the terms and conditions on any number of websites or apps that you use, most people just click that I have read the health ethics guide and I accept their terms without having ever opened the document. Well, what I have done is actually read the health ethics guide that is currently in place in many Catholic healthcare institutions across Canada. And my message to you is that whether you are a Catholic or a non-Catholic working within a Catholic healthcare institution, I encourage you, please read the guide, understand what you are signing your name to, and if you find it objectionable, please do not sign, do not approve, do not lend your good name to the support of a document that contains many things that perhaps you will find objectionable. Now, what could be in this document that is objectionable? There's a lot in there. It's over 150 pages, and it contains a lot of platitudes and a lot of ideas that are perfectly unobjectionable and perfectly fine. Prejudice of any kind represents a fundamental denial of our commitment to the gospel message. There's several places where where people need to be treated with respect and dignity and equal treatment, regardless of their social standing, wealth, or any number of areas. So this is not entirely a bad document. It's sections on research, and an organ donation, for example, are largely well thought out and good, although there are a couple of things that I personally disagree with. But the crux of the matter is this is a document written for Catholic people who believe in the Catholic faith, and it is demanding that everyone in a Catholic healthcare institution abide by Catholic morals and values. And that is simply not appropriate given the fact that a significant fraction, perhaps even a majority of the 88,000 people that work in Catholic healthcare institutions do not themselves subscribe to Catholicism. So I'm going to give a few examples from here that you might want to consider before signing your name to this on the next time the compliance document comes around for your signature. So to give you a few quotations from this document, it says, "All those who work in Catholic healthcare are called to manifest the loving compassion of Christ today and to serve the Lord in those who suffer." And I mean, that's fine if you're a Catholic, but if you happen to be a non-believer or a Jew or a Muslim or a Protestant of any kind, or that might not be something that you're comfortable with. You're also signing that you that you understand that this is an acceptance of the Catholic Church's authority to teach definitively on moral issues. And I don't know about you, but I myself recoil at the notion that the Catholic Church is the defining authority on moral issues. Many of its teachings are on what it calls moral values, I deem to be personally to be extremely immoral. And if you feel the same way, you should not sign your name to this document. It says that the dignity of human persons are rooted in the relationship with God and being created in God's image and likeness. This, to me, is a very fragile foundation to respect human dignity, given that, according to surveys, approximately a quarter of the Canadian population do not believe in God. And if the foundation of belief in God is if belief in God is the foundation of human dignity, I'm not comfortable with that, and I would hope that it would be rooted in something more tangible and something more common. But there's also some things that I find truly objectionable. So let me read a couple of passages, and both of these passages come from the very same paragraph within the Health Ethics Guide. It says, a female who has been raped should be able to defend herself against the possibility of conception from the sexual assault. Well, this is good. I agree with that statement. But then just a couple of sentences later, it continues, those treatments that cause the removal of, destruction of, or interference with the implantation of a fertilized ovum are not permitted. That, to me, completely contradicts the first one. And if you are not okay with the victim of a sexual assault being able to get rid of a pregnancy that may result from that, then, again, you should not put your name to the Health Ethics Guide and signing that you agree to those terms. There are several other things in here that, again, are not something that in my view, anyone who is moral in a modern society should agree to or would agree to. The use of procedures or drugs that deliberately deprive the marital act of its procreative potential, whether temporarily or permanently, is morally unacceptable. And direct sterilization, whether permanent or temporary, for a man or a woman, may not be used for the regulation of conception. So if you work at a healthcare institution, a Catholic healthcare institution in Canada, and you are signing the Health Ethics Guide as published by the Catholic Health Alliance of Canada, then you are agreeing that getting a tubal ligation for a woman, or prescribing the pill for a woman, or giving a vasectomy for your male patients is morally unacceptable. If you agree with that, by all means, sign the document. If you don't agree, then please do not do so. I think that people need to be aware of this. It goes on. There are many other things in here, and I promise you that the Centre for Inquiry Canada is going to do a deep dive and analysis and bringing to light all of the things. But there is a lot more in here, whether it's about sexual reassignment, giving gender positive treatments for whether through drugs or surgery, that is out. Artificial insemination, in vitro fertilization, freezing of embryos, all of these are forbidden. Any kind of genetic screening. So if you want to know if an embryo has Tay-Sachs or Down syndrome, again, forbidden. It cannot be done if within a Catholic healthcare institution. To say nothing, of course, of medical assistance in dying. Embryonic stem cell research is prohibited. So there's a lot in here that it claims are ethical that I personally find to be profoundly unethical. And I want to close with just a couple of additional thoughts. One is, I have no problem with Catholic doctors practicing medicine. Some of our greatest medical professionals profess a Catholic faith. Catholic faith and are excellent doctors. And I want Catholic doctors to continue practicing medicine, just as I want atheist doctors, Jewish doctors, Muslim doctors, Hindu doctors, and so on. Sikh, Buddhist, all of these people should be represented in the medical community and practicing medicine. What I object to, however, are doctors practicing Catholic medicine. I do not want to go to a Jewish hospital, a Catholic hospital, a Baptist hospital, a Muslim hospital. I want to go to a hospital where I get the best treatment possible. And I want that for my family, and I want that for my community. And I would hope that that's what you would like as well. The other thing I would like to say is that I've heard the objection that this is just boilerplate text. Nobody reads it. Nobody cares. What matters is the healthcare that is provided, and not what is in an ethics guide that is just a piece of paper or a piece of text on a website or in a PDF document that hardly anybody reads and doesn't abide to. And to that, I would say, well, either this document has merit, either the document is an ethics guide that is meaningful and is binding, or at least highly suggestive of what behaviors are going to take place, in which case its content matters. And if you're going to sign your name to it, then you need to understand what it says. And if you find it objectionable, conscientiously object to adding your signature that you agree to those terms. The other possibility is that it is truly meaningless and that it is just a bunch of words and that who cares and why bother, in which case, why go through the charade of adding your name to a document that has no meaning? And again, there should be a conscientious objection. So once again, if everything that's in there is something that you agree to, then by all means, sign the document. But if you work in a Canadian Catholic healthcare organization and you are asked to sign that you read and understand the Health Ethics Guide as published by the Catholic Health Alliance of Canada, please think twice before doing so.